So, as I mentioned, I'm a practicing physician. I am a board certified in internal medicine. I work in a nonprofit hospital system in southeastern Michigan, and I think that our other panelists have really, shown the point that cost and affordability is really one of the things that community solar can offer. I think that's extremely important. I don't want to take away from that. I want to add to it and put it through the lens of how this can help from a health perspective. So I think saving costs obviously allow people to spend money on other things such as medications, stable housing, transportation to and from medical appointments. We all know that the costs of medical care are just rising. And I think, we're talking about equity too, because even if you want to have solar panels, you may not have a housing structure or, the location where you can do that. And I think you should have the right to take a little control of some of these energy costs that are being driven by some of the utilities right now. And those costs can go towards taking care of yourself and your health and other essential life-saving things. I think the other problem is that our energy grid in Michigan is under a lot of strain. Power outages are becoming more common for various reasons. The energy usage is going up. So community solar allows us another way to strengthen our grid and hopefully help take some of the burden off of it and prevent some of these outages. I care about these outages because, as any emergency health providers or first responders will tell you, when the power goes out, they know to expect a surge in the emergency department, right? When these patients need oxygen, they need refrigeration for their insulin or other medications, they have nowhere else to turn if the power goes out. So they're going to come into the hospital. And that's going to drive up costs for everyone, right? The insurance companies are going to pay for this, but who's going to pay those premiums? Ultimately, we are, right? So I think first, we're lowering costs for everybody that can help save on medical expenses and focusing on other ways to keep them healthy. We're investing in our electrical grid by allowing people to invest in solar technology who otherwise would not be able to. And this strengthens our energy usage as a whole and prevents, hopefully, those harmful outages. And then lastly, I think, unfortunately, I can't talk about solar without focusing on the harmful effects of fossil fuel pollution. Right now, our grid is very dependent on oil and gas. And burning these fossil fuels is what is causing a significant amount of air pollution. And this has been tied directly to cardiovascular and lung disease, preterm baby deliveries, even dementia. And so anything that's allowing another alternative, right? And I shouldn't even use the word alternative. We don't have to have this as an alternative energy source, but this is decreasing how much fossil fuels that we're burning. It's going to decrease air pollution, and it's going to directly make our neighbors, our friends, or family healthier. So in my mind, investing in community solar and having this as an option, making it accessible to everybody, helps support our public health infrastructure, and really we're investing in Michigan's future. So I think from a health perspective, you can't deny that people are going to be healthier if we start investing in more community solar.